Hello, today we are going to be talking about artificial eye or ocular prosthesis. As an ophthalmologist, we always try and give back the vision the patients originally had when they present to us with visual disability. There are few patients who present to us with irreversible loss of vision or deformed eyes, wherein we really cannot do anything about the deformity, but we can always try and fix the deformed eye by placing an ocular prosthesis. This ocular prosthesis is an external device or external additional device that is fitted over the existing eye many times. Sometimes if the patient has got painful eye wherein the ocular prosthesis cannot be fixed over the existing eye, we do a small surgical procedure and then fix this ocular prosthesis. It's an outpatient procedure and usually patient has to come for a modeling eye and then we try and create a symmetrical eye that matches exactly with the other eye. Movements most often cannot be presented 100%, but 30% conversational range of movements can be present in the artificial eye as well. So it is not really possible for us to give back the vision sometimes. So these sort of patients will definitely benefit with ocular prosthesis. Thank you.